Assalamualaikum, welcome back to my channel. Hope you guys are well. Today we will discuss about the plain X-ray of chest PA view. So this is the plain X-ray of chest PA view. When we will take the X-ray, we will explain it as this is the plain X-ray of chest PA view showing radiolucent and radio-opaque shadow. The costophenic and the cardiophenic angle are normal and cardiac shadow present. Trachea is centrally present. So now we will discuss about costophenic and the cardiophenic angle. Here the cardiophenic angle. These two are cardiophenic angle and here is costophenic angle. Now, what is costophenic angle and the cardiophenic angle? Costophenic angle is that angle between ribs and diaphragm. And the cardiophenic angle are that angle between heart and diaphragm. So, this is the cardiophenic angle. These two are cardiophenic angle and here is costophenic angle, and here is shadow for heart. This is cardiac shadow, and here is arch of aorta here. So the shadow formed by arch of aorta here is called aortic knuckle or aortic knob, and here is pulmonary trunk. This is the clavicle. Here is anterior border of the lung. This is the anterior border of lung, of right lung, and anterior border of left lung. And here is apex. Now we will discuss about what is radiolucent and radio-opaque shadow. Radiolucent is black in color and the radio-opaque is white in color. This is radiolucent and here the shadow that is white in color, that is radio-opaque. Radio-opaque occurs when the X-rays get interrupted by viscera or bones, then it became white in color, and when it goes through the air like lungs, fundus of the stomach, here is fundic gas, so here is it becomes black in color. So that's the radiolucent and radio-opaque shadow, and these angles are normal. The costophenic and the cardiophenic angles are the normal, but when there are accumulation of fluid in the lungs or pericardium, these angles become obliterate, and if there is pneumothorax, like accumulation of air in the lung fields, that is pneumothorax, then the film will become more black in color, and if there is accumulation of fluid in the lung like here, then it will become white in color because the X-rays got interrupted by the fluid. Now I am discussing about trachea. Here is trachea. The trachea is centrally placed, but if there are fibrosis in the lung or tumor of the lung, then the trachea deviated same side or opposite side. Here is apex of the heart, or you can call cardiac notch for apex, and this is the fundus of the stomach. This demarcation, look here, there are demarcation. This is fundus of the stomach, and this black shadow is fundic gas. Now look, I am telling about ribs. This is the first rib. Here the first rib that comes from posteriorly to anterior. Posteriorly it becomes transverse and anteriorly it becomes oblique. So this is the first rib and this is the second rib, third rib, fourth rib, fifth, sixth, seventh. Like this there are ribs. And so this in X-ray, right border of the heart formed by, this is the right border of the heart that is formed by brachiocephalic vein, superior vena cava, right atrium and inferior vena cava. But in viscera, right border is formed by superior vena cava to inferior vena cava. It extends from superior vena cava to inferior vena cava. Where the left border is formed by, in X-rays, here, arch of aorta, pulmonary trunk, arch of aorta, pulmonary trunk, left auricle and left ventricle. But in viscera, left border of heart is formed by, actually it extends from the left auricle to the apex of the heart. So that's all about the plain X-ray of chest. This I am discussing about the normal plain X-ray of chest. When we will take X-ray in our hand, then we will discuss it like this. This is the plain X-ray of chest. PA view showing radiolucent and radio-opaque shadow. The costophrenic and the cardiophrenic angle are normal and the cardiac shadow is present. The trachea is centrally placed. So that's all about the plain X-ray of chest. I hope you guys are getting help from my video. Do subscribe my channel. So take care. Allah Hafiz.